Hi, I'm Steve Ansell. I'm one of the physicians at Mayo Clinic. I'm a hematologist and specifically lead the group that is interested in Waldenstrom's macroglobulinemia. Myself and my colleagues are very interested in moving forward as far as getting new therapies for Waldenstrom's macroglobulinemia is concerned. Waldenstrom's macroglobulinemia is a relatively uncommon type of cancer. It's a B-cell malignancy or a disease of B lymphocytes, and only about 1,500 patients are diagnosed every year. Patients, however, can have the disease for a long period of time and often can have significant symptoms because of that. So it actually becomes a significant health problem as the number of patients increases as patients are living longer and longer with this disease. So, Waldenstrom's macroglobulinemia is a cancer problem of B cells or B lymphocytes, as well as plasma cells, which are cells that make antibodies. In Waldenstrom's macroglobulinemia, not only is there an overgrowth and are there too many of the malignant B cells, but there is also overproduction of an antibody called IgM. IgM is a big protein, 5 antibodies stuck together, and because it's such a big protein, it causes much in the way of difficulty as it sticks to various tissues in the body and thickens the blood, making it difficult for the body to pump the blood around. Because of that, patients can often have problems with viscosity and also can have problems as the bone marrow becomes packed with cancer cells that are suppressing the growth of normal and good cells. Our goal with treatment for Waldenstrom's macroglobulinemia is to inhibit or kill off cancer cells and prevent the production of the abnormal protein. Because Waldenstrom's macroglobulinemia is relatively uncommon, many physicians have very limited experience with this disease. I would encourage patients to seek out expertise from centers that have a lot of experience with the disease, because the treatment needs to be tailored specifically for you. So again, as new patients are diagnosed and as previously diagnosed patients come to treatment decision points, seeking out expertise from people that are knowledgeable in this arena would be something that would be advised. The main reasons that physicians and scientists engaged in research and patients engaged in clinical trials participate in trials or do the research is because patients and physicians want to see new treatments for Waldenstrom's macroglobulinemia patients. One of the exciting things about research today is just that the new research is actually translating into clinical trials with new agents that are promising in the world of Waldenstrom's macroglobulinemia. Here at Mayo Clinic, we're actually trying to be at the forefront of leading the development of these agents and are participating in trials of treatments that inhibit the B-cell receptor and also that change the microenvironment to most favorably get the immune system to target the cancer cell. I would encourage patients to seek out opportunities to participate in clinical trials and seek out opportunities to participate in basic research. Ways you as a patient might be able to help would be to consider participating in a trial when such a trial is offered. Trials could be with new therapies and trials could also be with established therapies, often with additional new agents added. But also, even if you may not require therapy right away, consider participating in studies where your bone marrow is tested for research purposes, or you fill in a questionnaire about your disease or about your symptoms or about your heritage and family that help us understand this disease better. So all told, these are exciting times for patients with Waldenstrom's macroglobulinemia. Over and above standard therapy, which often is very effective, novel drugs and novel therapeutic approaches are actually very promising. Again, our hope is that down the line, these therapies will actually result in favorable outcomes for patients and good prognosis for patients long term. Thank you.